Welcome to Starkey at a Glance. I am Via Heath, Customer Service Audiologist at Starkey, Australia. Today we will be discussing best practices and some technical aspects when it comes to impression taking. We can divide taking an impression into 3 steps: the preparation phase, then actually taking the impression, and then the final phase. In the beginning, it's so important to record the ear history. Really ask your client about previous ear surgeries, health conditions at the moment. Did they gain or lose a lot of weight recently? And also ask them about devices they were previously fitted with and if they had any fit issues. Prepare your tools and supplies beforehand so that you are relaxed when you take the impression. You don't have to rush around while the material cures. Infection control is important, so if in your practice you need to wear gloves or have hand sanitizer or alcohol swabs handy, keep them close by so that you can follow proper protocol. And then, of course, perform otoscopy to look at the ear canal and the tympanic membrane. If there are any signs of inflammation, infection, the ear is draining, or you just don't feel comfortable taking the impression that day, that is not something to feel ashamed about. In our profession, we don't want to cause harm. So if you're in doubt, please refer to a specialist and postpone the appointment. The impression can be taken at a later stage. If you do go ahead, give the instructions beforehand, because when you have both impressions in the ear, the client's not going to be able to hear you. So instructions beforehand is important to put them at ease and so that they know what to expect. That really goes a long way. Then placing the auto block in the correct position, preparing and injecting the impression material according to the manufacturer instructions, waiting a sufficient time for the impressions to cure, and then removing the impression carefully from the ear. Afterwards, it's important to perform otoscopy again to make sure that there's no impression material or parts of the cotton dam left in the ear. And this really then drives your discussion with the patient. When you remove that impression, inspect it for voids and incomplete parts, but then also take into account what you want to fit, what your patient asked for, and if the impression will really give you that. And then organize your impressions to be sent off to us either in impression boxes and make sure that they are organized. But always use clinical judgment. And if you are unsure, then postpone that appointment for a little bit later until you feel comfortable. It's important to use proper tools. Proper seating is very important. We do recommend that you sit at eye level, so looking at the client's ear in a straight line. And especially when taking the impression, it's not a good idea to take it from an angle above. You really are going to take a better impression when you see it at ear level. Lighting, of course, is important, and a bright, narrow ear light so that you can see what you are doing. Your forceps and curettes for if you have to remove wax and it's within your scope of practice to do so. Here we can see the proper bracing techniques for holding an otoscope, so the hand bracing against the patient's head, and that is to fend off any sudden movements if the client pulls away or leans in, to not cause damage to the eardrum. Now we have a look at auto block placement. For deep impressions, IIC devices and CIC devices, it really is important to have that auto block placed close to the tympanic membrane, as close as you can get it, and definitely past the second bend of the ear canal. But even with standard impressions, you want to place it as deep as possible, because we never know when we might run into retention issues and we need a longer canal length. So the longer they are, the better. It's also a good idea to flatten the cotton dam so that it doesn't take up too much space and take away from the canal length. We do recommend cotton dams. And it's a good idea to flatten the dam so that it really provides a seal and seals off the tympanic membrane so that you don't have blow by when you do your impressions. So very important to determine the size, and if you are in between sizes, you can go to a bigger size and then reduce it to where you want it to be, and then tie the thread to make sure that it's secured, and then flatten the cotton dam to get that seal. Cotton is usually more comfortable than foam, because if you work that deep in the canal, the foam can be a bit scratchy. You can then lubricate the cotton dam. That eases insertion into the ear canal, but it also keeps those cotton fibers together. We are now going to then prepare the impression material to get it ready for injection into the ear. As I said, per manufacturing instructions, whether you use the impression syringe or the gun with the cartridges, but it's very important to bleed a small amount of material from the syringe because there could be air bubbles that could create noise trauma. And so we want to avoid those air bubbles in the impression material. Then position it aimed at the auto block and keep the tip of the syringe or the gun into the material as you inject it, and make sure to get the full canal, concha and helix, and remember to use those safe bracing techniques throughout. Here you can see some pictures of good bracing with an auto light, the impression gun as well as the impression syringe. A lot of clinicians prefer to use the gun because the material's viscosity, it's more flowy, and so it gives them a little bit more time before it cures, but it also creates less fullness in the ear when you inject the material. You can also take very deep impressions with an impression syringe, and I always feel use what you are comfortable with, because if you are comfortable with something, you will have the confidence to take a good impression. And if you are tense, your patient will sense that. So use what you feel comfortable with and what you've been trained with. So the ear is really the boss. And next we are going to look at a video of Ray. He's a very experienced clinician in the US that works in the Center of Excellence, and we're going to observe his impression taking technique, and I'm going to talk you through it then. So here he's just determining the size of the auto block that he's going to use. He often uses a size 3, and sometimes it's necessary to reduce it a little bit, or he'll use a size 2. He's now going to use his lighting and gently and in slow movements insert that auto dam to be as close to the tympanic membrane as he can get it. And take care not to poke at the cotton dam. It's really gradual, slow movements, and he's going right around the circumference to make sure it's sealed. Now observe how he keeps the tip of the cannula in the impression material until the impression material comes out of the ear. Only then will he go up to the helix and concha and make sure the anterior fossa area is filled as well, and then remove the tip from the impression material. It can take a good 5 minutes to cure, so prepare your client for that. Then break the seal by gently pulling on the ear. You can also ask the client to open and close their mouth to break that seal, and then gently remove the impression and inspect the quality of the impression. Thank you so much for watching. If you have any more questions on today's topic, please reach out to your product specialist or call us in the office on our toll-free number 1800 024 985.